No. When the people were laid off mandatorily because businesses had to be shut down, how is this going to impact the 20 categories of payback to the different businesses? Because some businesses, I'm sure, shut down that had probably were in category one, $10, and others were up in that $1,800 category. And so for the $10, which I never agreed with the $10, I thought it was wrong. I thought the lowest tier should be $110. That way it was more across the board. But nevertheless, when they came back to work, how's this going to impact their tiers?
And it's my understanding under current law, it would not have an immediate impact on any of those tiers, that they would be suspended for at least a year. I think it speaks to that if you're in a recession, that it would be suspended for that. But I think in doing this, it will make sure that regardless of what tier you're in, you're going to make sure that those funds are going to be restored back to make sure that there's not an additional, back to your point, it will not be an additional surcharge put on those businesses going forward from that standpoint. So it is geared toward doing this and making sure that we're helping those businesses across the 20 categories from that standpoint.
Well, that sounds fantastic.
Yes.
Another thing that happened in real life is I'm in the lowest tier, $10, ridiculous, but I'm there. And I get a letter of unemployment. You are eligible to an employee that you are eligible for unemployment. And I'm looking at that employee working live. And I've got several of those kind of letters. I don't understand. I had not been notified ahead of time. No questions, no nothing. Is this was sent, this employee is eligible for unemployment, and that employee was working. And I wrote back and said, no, they're not.
Yeah. Well, and I think that demonstrates as good as intentions that the federal government has had to do to try to move as quickly as they can. They put several different programs into place, and as we know, sometimes that it takes additional changes to those programs once they get up and get going, that they do find some glitches in there that have to be addressed from that standpoint. But I think under the circumstances, they moved as quickly as they could. So, thank you.
Well, I hope somebody's watching.
Yes, sir. All that will be audited, and that's another component. Be assured of that. Thank you, Mr. Chairman. And at this time, I would acknowledge and recognize the senator from Greenville, Senator Turner, for his report.
Turner, good to have you before Finance
Thank you.
Committee.
Good to see you. Good to see all these people in finance. Glad to know who's on this committee now. I appreciate being here, and thank you, Mr. President, for appointing me to the Accelerate SC Committee, Open SC Committee. It's been an honor to work, and really Accelerate SC was an honor to work with the people from around the state, business leaders, and the one thing I'd say about all those people is they left their ego at the door when we got in there, and we did what was best for South Carolina at that level. And then when we got to Open SC, I think we did the same thing, and great leadership from the chairman, like you said, and just proud to be a part of the team. They've given me a few areas to touch base on. The first one being tourism. Recommendation 11 of the Select Committee's report, page 4, recognizes that South Carolina's tourism industry, an industry which generates over $24 billion in spending for our state's economy, has lost a significant amount of money due to COVID-19. In mid-April, tourism spending in the state was down 87%, according to the Accelerate SC report. The state's tourism industry is focusing on the 8-hour drive time visitor, and the Select Committee recommends funding be given for tourism promotion within the 8-hour drive circle. They did a presentation on that, thinking that there's not going to be a lot of air travel as much this summer, so it was more about people that can get to them by driving. The one thing I would say I saw in the paper this morning, a nice turn, is that Myrtle Beach, I think, was reporting that over the last few weeks, they were only down about 16% from last year in hotel reservations. So I think South Carolina's positioned to come back strong, and that's just a reflection of that. Telehealth, a lot of this was mentioned by Senator Malloy, but I'll touch base on it too. The digital divide, which exist across the state due to our lack of broadband access, has been highlighted during the COVID-19 pandemic. Not only have students been impacted, but the lack of a statewide broadband system also impacts the availability of healthcare initiatives like telemedicine and mental health services for citizens without the internet. The allocation of $50 million for broadband infrastructure in Recommendation 7 that was talked about will impact telemedicine, which is a significant and rapidly growing component of healthcare in the U.S., from the use of remote cardiac monitors to doctors and medical practitioners providing services for patients, while those patients remain in their homes using a computer to app-based screening tools for COVID-19. The use of telehealth will only continue to increase. Telemedicine is a safe and cost-effective way to extend the delivery of health care to South Carolina's rural communities. Just one side, I know he mentioned about how fast we got electricity. I think it was from 1940. 97% of rural South Carolina had no electricity, and by 1949, that number was reversed. So it's very possible how fast you can get it out there. Also, just on a side note, think it's a huge boom potential for small towns now that people can work from anywhere. So there's a chance that they'd rather have a small town life even though they have a big city job. So I think that'll be a huge opportunity. Hospital funding. The list of enterprise initiatives is included in recommendation number 17 in the Select Committee's report. Included in this list is $250 million for public and private hospital reimbursement, which mirrors the amount recommended in the Accelerate SC report. Hospitals and healthcare facilities have been on the front lines of the battle against COVID-19. According to the Accelerate SC report, the CARES Act permits expenditure of federal funds to hospitals and healthcare facilities for COVID-19 related expenses. Additional COVID-19 related expenses for hospitals and healthcare facilities have been requested from the South Carolina Hospital Association after consultation with these facilities throughout the state. According to the Accelerate SC report, public and private hospitals reported over $208 million in direct expenses through May 18th, and estimates expenses of over $740 million through December. In addition, MUSC reported over $99 million in expenses through May 18th and estimates expenses of over $177 million through the end of 2020. That kind of concludes my report. The one thing I would say, two good things that came out of moving this thing through, I think, were the auditor and then also the discussion of phasing in the expenses so that we get to October, we may find more money's needed in another area. And so I think those are great recommendations and a great way to look at this. So.
Anyone have questions? Martin, I'm sorry.
Sure.
Thank you, Mr. Chairman. Senator from Greenville, thank you for serving on this committee. I do have a question. I want to go back to the question I asked Brian earlier today at the start. When I asked him I was talking about MUSC, and I'm going to assume it's going to be the same for all the others, but I asked, are they claiming lost revenue from shutting down their non-COVID services? And his answer was yes. So if this is COVID related, a lot of these hospitals, they made a choice to shut down their non-elective procedures and things like that. And I want to make sure that this money isn't going to reimburse them for things that they chose to do on their own. I just want to be very careful because I believe that that the experts, the so-called experts from these areas, they help collude to shut this state down. Right. So I just want to be very careful there. And are you aware of what I asked Brian? And would you say your answer would be yes, that they are claiming revenue loss from non-COVID related services?
I don't want to overstep because I trust everything Brian has said because I've watched him in meetings handle himself, right. And I trust those numbers. The one thing I would say is the one thing we looked at with CARES Act money was that it could not be used for lost income. It had to be direct expenses and not lost income. That being said, it's just like he also said, there's about 50 pots of money out there. One of those pots very well may be lost income money for hospitals. I'm not sure what that pot is. I only looked at the CARES Act money. I don't,
And that's all that's before us really right now.
that's
the
right.
CARES Act
That's
money.
right. So I wouldn't say there's lost income in that just from the big discussions we had. You know, it's like, it reminds me a lot back, I don't know, I'm sure some of you remember Hugo, but 1989 in Hugo had these claims. People hadn't dealt with a hurricane in forever, so they didn't know how to handle claims. And so all of a sudden you had people that were getting a total loss check from the wind and hail pool, and they were getting a total loss check from the federal flood program on the same house. We came out of that and we finally figured out, no, we need a single adjuster program. Well, I think that's kind of what we're doing with the auditor we've hired, is making sure you're only getting money from one pot.
Okay.
But Cindy, if there was another pot that provided money for lost income, that would be a direct from the feds. We have nothing to do.
We have nothing to do with
Right.
that.
Thank you.
Thank you.
Thank you.
Anyone else? Alexander?
Thank you, Mr. Chairman, and thank you, Senator from Greenville, for the report. Next, I recognize Senator from Beaufort, Senator Davis, regarding an update on business liability and then contact tracing.
You would. And thank you, Mr. Chairman, for, also Mr. President, for appointing me to Accelerate SC into this reopen committee. And I agree with all the comments that have been made about this working group. We really did do a lot of good work. I'm going to pass out simply, it's easier for me as a lawyer to kind of write down my ideas. And so I'm going to take up contact tracing first. And I'm going to pass out to you a short opinion piece. It's like 500 words that I think articulates the reason why we need to have a contact tracing policy from the General Assembly in this session coming up June 24. And we had a brief discussion in regard to contact tracing when we passed the continuing resolution. As you'll recall, Senator Alexander was asked questions in regard to what did these contact tracers do? What were the protocols? Were privacy considerations being followed? Was tracking involved? Because tracing sounds a lot like tracking. And I've done a lot of research in regard to contact tracing since then, and I'm going to go ahead and read a portion of what I think would be a reasonable response by this General Assembly. First and foremost, we must say that participation in a COVID-19 contact tracing program is voluntary and that its operations are fully transparent. I think there was some misunderstanding that somehow this was a mandatory policy, that there were going to be this army of contact tracers deployed, and that there was going to be a compulsory participation by South Carolinians. And so that's not the case, but I think it's important for us to articulate what is the policy in regard to contact tracing, because we do want to instill confidence in this program of South Carolinians. We do want those who have become infected to access contact tracers because it's an excellent form of communication. It's a way for them to learn about resources that can help them. It's a way for an individual to protect themselves and their families. Contact tracing is a decades-old practice. I mean, and it's very simple. I mean, if somebody is tested positive, they can voluntarily contact a contact tracer who will then assist them in figuring out what sort of relief is available to them, and also assisting in contacting other individuals who may have been in contact with that individual. So the very first thing is that it would be voluntary and its operations fully transparent. In addition, we have to make sure that that contact tracers are properly trained. We're not just simply hiring individuals, giving them a phone and say, go to work. There's actually some very good instructional materials out there. The one that I'm familiar with is one that Johns Hopkins puts forward that digs not only into the biology of COVID-19, but also talks about how to effectively counsel those who have been infected, and importantly, the ethical considerations such as respect for privacy. There also has to be no concentration or centralization of data collected. I mean, we don't want to have a centralized permanent repository of people's personal information. And so effective and responsible contact tracing programs are decentralized in nature, and the data goes away once it no longer becomes applicable or helping to accomplish a public policy objective. Finally, there has to be a broader discussion about the technologies that have been developed. And I'll just go ahead and read what I've written down here. There must be an ongoing public process to discuss, analyze, and thoroughly vet the newly developed digital contact tracing technology designed to help slow the spread of COVID-19, including technology that Apple and Google are building into their smartphone software. We cannot allow bureaucratic drift toward the widespread use of technology in South Carolina, even on a voluntary basis, without first having an extensive and open discussion of its merits and demerits, with civil libertarians like me asking hard questions. And the reason I think that's important, Mr. Chairman, is that we're already starting to see some discussion in our state agencies and also in MUSC toward developing technologies or allowing smartphones to share information with each other, iPhones and Androids. That's obviously a predicate to perhaps using an app. And I think it's important for this General Assembly to speak to that and to say that before that gets implemented and before even on a voluntary basis that it's used by South Carolinians, that this General Assembly have a debate and that this General Assembly authorize it. And so that's the last piece of the contact tracing protocols that I would recommend, or that our group is recommending for the General Assembly to consider. And I think there's two vehicles through which it would be. First of all, this COVID-19 appropriation budget will have money going for testing and for contact tracers. I think it's appropriate to incorporate the substance of these observations into a proviso which would accompany those dollars. I think it's also important for us to try to pass some standalone legislation in regard to what, or a joint resolution or something that would last during the course of this pandemic, because this is something that people of South Carolina, even though contact tracing is decades old, a lot of South Carolinians are learning about it for the first time. And when you don't know a lot about something, fear can be instigated. And you want to put those fears to rest because you want people to know that privacy protections are in place and you want to encourage them to participate. And so that's why this committee, I think it's recommendation number 19, recommends that this state have a policy articulated by the General Assembly in regard to contact tracers and what they can and can't do and what the privacy protocols are, and to make it clear that any use of apps or technology with iPhones or smartphones be deferred until such time as this General Assembly speaks directly to that issue. So those are my opening thoughts in regard to contact tracing, and I'll be happy to pause in that regard before then going on to the second piece that the chairman has asked me to speak about.
Anyone have questions, Senator Davis? Jackson?
Yes, sir.
So help me understand the app deferment that you're recommending.
I'm sorry, sir.
So the app deferment, you're saying that if any app is developed, that the app cannot be implemented in South Carolina until the General Assembly speak to it?
That would be the recommendation, Senator Jackson, because and the reason for that, and again, the reason for that recommendation is this technology is so new. Google and Apple just announced a technology that allows their devices to communicate with each other. That I think that there are privacy and ethical implications of this that we simply have to grapple with. And it may well be that we can be satisfied as to that. And I've had Zoom conferences with Apple and Google employees explaining this process to me. But I wanted to alert, or I think our committee wanted to alert the General Assembly to this issue is out there. And we do have MUSC contemplating perhaps utilizing it. And to some degree, I think DHEC has been involved in it. So I'm not saying that it can't be an effective mitigation strategy, but I think that it's incumbent upon us as the people's representatives to speak to that issue and not just simply let the state agencies make that decision for us.
So if an individual would desire to do it, you would say to them that they can't do it until the General Assembly speaks to it and give them permission?
Well, we're only speaking, we can only speak as to what DHEC as a state agency would do. So we're speaking as to DHEC's participation in making that app available. Now, what happens in the private sector and what happens voluntarily, we can't speak to that. But I think that we do have the ability and the obligation to speak in regard to what DHEC's participation in that would be.
And so it means that DHEC can't even recommend it or talk about it or talk about the benefits of it. I guess my concern is that the urgency of now, the urgency of the health crisis, do you think that lends itself to a procrastinated decision by the General Assembly? You know how long it takes.
Actually, I would state it differently, Senator Jackson. I would encourage DHEC to talk about it and to weigh the pros and cons, and then to share that information with us. I mean, I'm not telling DHEC to put blinders on and don't consider this. What I'm saying is, before we have a state agency that participates in the implementation of this app strategy, I think it would be, or at least it's the Reopen Committee's suggestion that the General Assembly speak directly to that. So certainly DHEC should explore it, should ask the questions, and then should give us the information.
Okay, and finally, speak to it means the General Assembly approve it, meaning getting 174 people to vote to approve it through both bodies, through the committee process, subcommittee process, filibuster process, all of that?
It would, I suppose, Senator Jackson, like any other of this legislation that we're proposing, it would take, I think, on an expedited basis, probably unanimous consent. But the alternative is to simply do nothing and to allow state agencies to adopt policies and procedures that may not be what this General Assembly considers to be appropriate. And so I'm not saying it's a bad idea. I'm just being frank with you that I don't know enough about it. And whenever you talk about an app and something that automatically transmits data to a central agency like DHEC, it gives me concerns in terms of privacy.
Senator Burden.
Thank you, Mr. Chairman. I want to say thank you to Senator from Beaufort and the other members of the Restart Committee for giving attention to this matter. I completely concur with the Senator from Beaufort in regards to even in times of crisis and pandemic that we have to be even more careful to safeguard matters of privacy and constitutional provisions for all of there's a lot of unforeseen things, and just in response to Senator from Richland, I wouldn't advocate for procrastination in addressing the matter. I would echo again the possibility of expedited and facilitated debate on the matter. It's something that can be accomplished 21, 22, and 23 of June. It pained me last month in the CR debate to question, to have reservations on the CR on this very point. So I appreciate what's been offered, and reviewing that joint resolution I assume that you've authored. I would say thank you again to all the members, and would encourage us all to give it close attention between now and the first opportunity for the General Assembly to adopt such a policy for our agency. And Senator from Richland, I would encourage anyone that wants to, within their rights as an individual, to participate and to collaborate, absolutely. But as it relates to the power and long arm of the government, General Assembly needs to speak.
Anyone else?
Thank you, Mr. Chairman. The second thing that Chairman Alexander asked me to talk about are issues concerning business liability within the context of COVID-19. And actually, as our subcommittee met, and we had a very good subcommittee, a good cross-section, I think, of the General Assembly. Senator Turner, Senator from Greenville, Senator Malloy, Senator from Darlington, and Senator Shaheen, Senator from Kershaw, and I served on that committee. And what emerged is there's really three baskets of concerns, and I'm going to talk about the three baskets. And as far as I'm concerned, they all rise or fall together. I mean, at least as far as I'm contemplating it, it would be in one joint resolution. We wouldn't separate them out. So I think they all travel together. The first is in regard to workers' compensation. And one of the things that has been suggested and that we're recommending, although we don't have a bill yet ready for your consideration, and we're going to be meeting immediately after this meeting to hopefully finalize some text. But initially, there's some question in the workers' compensation context as to whether or not contracting the virus during the course of your employment qualifies as a compensable injury under the workers' compensation statutes. Now, there is a section in there that talks about occupational diseases. But there's a question as to whether or not COVID-19 falls within that. So the first recommendation, I think, coming out of this subcommittee will be an acknowledgement that if an employee contracts the virus during the course of their employment, that then constitutes a compensable matter under our workers' compensation statutes. And again, I want to emphasize, this is a joint resolution that would be for a limited period of time that would sunset, I think we've been talking about within a year, okay? The second issue in regard to workers' compensation acknowledges the difficult evidentiary hurdle that a worker would have to prove to a commissioner that the virus was in fact contracted during the course of their employment. I mean, that becomes a very hard thing to prove because you could contract your virus from so many other places. And so what we've arrived at in that regard is looking at first responders, healthcare workers, individuals who we have asked to go into harm's way to take care of South Carolinians, that we have talked about as to those classes of employees, that there be a presumption that the virus was contracted during the course of their employment, okay? So as to those first responders, and again, we're talking about healthcare providers, correctional employees, I mean, people that are out there amongst individuals who are infected, that there be a presumption that it was incurred during the course of their employment. Now, there's some things to be ironed out in that regard. I'll be frank with the committee. Should that presumption be conclusive, or should it be a rebuttable presumption? And I don't want to get too much down in the weeds here, but I'm letting you know that we've had a frank discussion about the impact of COVID-19 on the workers' compensation system. The second thing that we talked about is in regard to some sort of a qualified safe harbor for businesses who tried in good faith to take the proper health protocols or safety protocols. And so what we're talking about here is a temporary departure from the common law, because right now what you have is common law negligence, in that if a plaintiff files a lawsuit and if he or she can demonstrate that the business didn't exercise reasonable care or act in the prudent way, that you can then establish negligence and make a claim for damages. The problem here is that there's so much conflicting information out there in regard to what are good protocols. You've got the CDC saying one thing, the World Health Organization saying another, the FDA, Dr. Fauci, President Trump, the governor. I mean, so you've got all these different and disparate individuals and entities telling the business community what is reasonable. And you have, and it changes to this day as we learn more about the virus. And so the thinking was that because that standard of care is so in flux, and because it's subject to change, that maybe you could create a safe harbor whereby if a business was following an established protocol, during the pandemic, that would serve as a safe harbor from liability. Now, to be frank with you, there is some dispute about this among the stakeholder groups, and we've had numerous meetings with the Trial Lawyers Association, Injured Workers, Manufacturers Association, Chamber of Commerce. We've been trying to, do the Venn diagram where there's all these circles and then figure out where the overlap is. And to be very frank, is the trial lawyers have a problem with statutorily defining a standard of care. What are you going to say? Who are you going to point to? Who's going to be in charge of saying that? And so we've taken that into consideration, and we're trying to decide whether or not that's still a logical way to proceed. Another way to skin this cat and to provide some measure of relief for businesses that are operating in good faith is for a temporary period of time, for instance, raising the evidentiary standard. Because right now, a plaintiff has to prove by a preponderance of the evidence that a business acted negligently. Okay, if you don't want to monkey with what the standard of care could be, you could perhaps take that preponderance of the evidentiary standard and make it clear and convincing evidence that they breached the reasonable care. So there are different ways of trying to get at that objective. And we're meeting, Mr. Chairman, immediately after this to take that up, and fully cognizant that this is something that's going to have to be a consensus bill that all the stakeholders feel comfortable with. We've been working hard and grappling with it, but we still got a little bit more work to do. Hopefully we'll have something coming out of subcommittee today or at the very latest sometime later this week. Lastly is in regard to what I think of as sort of the Good Samaritan, where instances where we asked businesses during the pandemic to shift what they were ordinarily doing and to devote themselves to making PPE, to making masks, to making ventilators, to making other things. We've asked them, we encouraged them to go ahead and divert from what they ordinarily do to doing something different. And for those businesses, okay, I asked for those businesses that we wanted to make PPE and get away from what they ordinarily do, what we're saying is that the standard for holding them liable for a products liability suit would be if they knew or had reckless disregard in regard to intentionally putting a defective product out there for the public. So that is an insulation. But again, this is in regard to the limited universe of businesses that we asked affirmatively, stop what you know how you're doing, stop what you ordinarily do, make PPE instead. So it would provide them with protection unless the plaintiff were able to show that they knowingly put something that was defective into commerce. So those are the three baskets that the so-called business liability, really more accurately stated, the litigation aspects that COVID-19 forces us to think about.
Anyone have questions or comments? Senator Davis, thank you.
Thank you, sir.
You tackled a tough one
I'm sorry.
here. I'm sorry, Senator Martin.
Sure.
Do you foresee the proviso handling our issues with voluntary tracing? If we don't have time for legislation.
I think the proviso would survive for so long as the COVID budget. So that would expire then on December 30, right, or December 31. And I think that the policy in regard to contact tracing ought to extend beyond the end of this year for so long as this pandemic or for so long as we're having to combat this virus. So I think I'd like to do both. I think the proviso does provide us with some protections, and but I think the better policy would be to try to find some vehicle and send it over to the House. Thank you, Mr. Chairman.
Thank you, sir.
Are there other questions? I'm sorry.
You,
Okay, thank
you tackled a tough one, Senator Davis. Yes, sir, Senator Grooms.
Back to the question on the app. Is an app actively being developed right now with the intention of being used?
The first thing, and this is, I had to learn the language, but as I understand it, the first thing that had to be done, and what I think MUSC is doing, I think, with Google and Apple, is developing the technologies whereby these different iPhone products can share information, because you've got Androids and you got iPhones. And so what's been done so far, I think, is that technology that allows devices to interface with each other. I don't think, and I see that, quite frankly, Senator from Berkeley, as a predicate for using an app at some point, because why else would you concern yourself with technology so phones can interact with each other unless you intended at some point in time to make an app available that would then upload that information. So I'm aware, because MUSC has announced it, I'm aware that they have entered into some sort of an agreement with Google and Apple as to the device sharing technologies. Don't know about an app itself, how far along that process gotten. The only reason I raise this is and the more I read on this, the more I realize I don't know. And I really think it's something that if we're going to do it, it ought to be something that this General Assembly speaks to, and not something that we just sit back and let agencies decide. I think this is something that's fundamental enough for us to weigh in on.
So what really brought this to a head is something that MUSC is working on?
One of the questions, Reopen Committee had testimony from Dr. Linda Bell, and I asked her the question about contact tracing, and was there any intent by the agency to use smartphone apps in connection with the contact tracing? And she said that no, that DHEC was not doing that it was a decades-old policy, and then went through the mechanics of how that works. A couple of days later, there was a widely published report that I think was on CNBC that South Carolina was one of the first states in the nation that had entered into this new app agreement, in regard to contact tracing. That was immediately disavowed by DHEC and by MUSC, quite frankly, because they sent a letter to the governor saying this story is incorrect. The following week, however, there was a press release by MUSC saying that they had entered into this agreement with Google and Apple as to the technology that allowed their devices to interface. But I haven't heard anything further in regard to an application.
Yeah, like you, I really want to learn more about this. I don't like being in a position of trying to move something forward, whether it's good or bad, without having the proper research to fully understand it and its implications. And it is a little troubling that we had two state agencies to disavow that they were moving in this direction, and then later on we find out that they are. It would be really great to hear from MUSC for them to speak to it at some point. But thank you for the work that you've done and also the other committee members. I appreciate the time that y'all have spent on this. Thank you, Mr. Chairman.
Thank you, Senator.
Thank you, Mr. Chairman. That will take us, and appreciate Senator Buford for that report, to the Senator from Lexington, Senator Shealy. She would come forward to speak briefly about the personal protection equipment and the unengaged school children. And Mr. Chairman, I certainly appreciate the indulgence of the committee's time for this. And
This has been invaluable to us, Senator.
Certainly appreciate the attention of the committee
We
members.
appreciate you and your members taking the time to share this with us.
And I will be brief.
Oh, no, you're good.
I'll be brief. Y'all know I don't talk long. Thank you, Mr. Chairman, and thank you, President Peeler, for putting me on this committee. Thank you, Mr. Chairman, for making me subcommittee chair for the Personal Protective Equipment Committee. The PPE subcommittee heard presentations from DSS, EMD, DHEC, and the Department of Administration. The Department of Administration, EMD, DHEC, SFAA have worked in collaboration to develop and administer the PPE mission plan to procure, distribute, and store PPE. Although state agencies and other public-private health care providers are encouraged to procure their own PPE independently, that would be like hospitals, big operations that can procure it. When possible, assistance when procurement and logistics is provided when necessary. So if you have smaller counties that can't procure it at a reasonable cost, or smaller hospitals, or let's say nursing homes, they're there to help. The maximum allocation of PPE was requested from the Strategic National Stockpile based upon the census data from 2010, that makes it very important that everybody fill out their census, so we'll get the right amount next time. But what happened when we got our Strategic National Stockpile this time, a lot of it was outdated. It was, old, it was rotten, or it was, it might not have looked bad, but it was, the date was expired on it. Some issues with inefficient supply of PPE, expired materials, and counterfeit products. The majority of the PPE received was either commercially purchased or donated, what we had. Centralized ordering allows for procurement for both small and large entities that have difficulty obtaining needed materials. To date, EMD has not involved any government entities for the PPE provided. A 28-day supply of PPE is recommended to address disruptions in the supply chain caused by a future emergency, in case we would have another pandemic or we would have a resurgence in the fall. The cost to establish a stockpile of N95 masks, surgical masks, gloves, gowns, eye and face protection is estimated to cost $16.7 million. However, this cost does not address consumable items such as hand sanitizer and disinfectant wipes, so that number would go up when we get the cost on that. The Department of Administration reports that state agencies, not including higher ed, spent $1.12 million on these consumable supplies during phase one of reopening, with only 38% of the workforce physically returning to their work sites. The stockpile can be stored at EMD's warehouse in Fairfield County. To rotate the materials so we wouldn't end up in the same position that the national stockpile was in, EMD plans to partner with large hospitals to supply them with PPE as needed and purchase new materials to resupply the stockpiles. Of course, they would purchase that PPE from the stockpile, and then we could rotate that so we wouldn't end up with outdated or unneeded supplies. The Select Committee recommends that we providing the $16.7 million to create a 28-day stockpile. So that was our first recommendation for the PPE. And before I get to the next recommendation, do I have any questions on that?
Anyone have questions?
That was pretty cut and dry. Okay, the next is the unengaged student issue. The South Carolina Department of Education has surveyed individual schools to determine how many students they have been unable to make any contact with since statewide closure beginning March 16th. This is why we need to have face-to-face contact with schools. The survey responses were due June 10th of 2020. As of June 11th, 2020, the department had received 850 responses from the 1,251 schools they surveyed. The department has determined that they have had no contact with 13,544 students previously attending the schools that responded. Now, when they first started talking to us, they told us there were 40,000 students. Then it went down to, first it was 49, then it was 40, then it was 31. But after we pressed them and told them that that was not acceptable, they got it down to 13,000. In the real world, if you were missing 2 children in the state of South Carolina, that's a Dateline story. If you're missing 13,000 children, that's a crisis. We need to lay eyes on these children. The Select Committee recommends that the Department of Education shall seek the assistance of the South Carolina Department of Social Services to help locate the students who were unengaged during this period of school closures. Somebody needs to find these children and lay eyes on them and find out where they are, which will also, the Social Services, Department of Social Services is probably going to ask for more money. I don't have that information, but that's probably what's going to happen there. But we need to find these children, and I think that's a very serious issue in South Carolina.
Anyone have questions or comments? And thank you for a great report.
Thank you, sir.
Thank you, Senator from Lexington. And now, Mr. Chairman, we'll hear from the Senator from Clarendon, Senator Johnson, regarding local governments and state agencies.
Thank you, Mr. Chairman. And I want to also begin my brief remarks by thanking President Peeler for appointing me to this committee. I would say that it was a learning experience for me, and I appreciated working with the committee that we had. We had a great committee under the leadership of Senator Alexander, did a great job that brought us to where we are today. As you know, I spent 17 years before I came here as a local elected government official, so I can understand, although this is an unprecedented event, I can understand how it has affected local government in a negative way. So our committee have a few recommendations that we think will help local government. The first being that we want to instruct the Comptroller General to advance the local government fund by 1 quarter. That payment will be made on January 1st as opposed to April 1st, and it would be $61 million. It's not new money, it's just advancing the money 1 quarter. The next recommendation that we have from the committee is that we want to request that a proviso be included in the COVID-19 budget to allow political subdivisions to adopt a continuing resolution. Now, we're also going to ask that the Accelerate South Carolina Committee request an opinion from the Attorney General to make sure, or to see whether local governments can in fact utilize a continuing resolution. And then our third recommendation as a committee would be to allocate funds to cover the expenses that local government incurred under this pandemic. Right now, we're at about $61 million, and I think the breakdown for counties and municipalities can be found in the appendices A and B. But we want to ask that the local governments submit their expenses to the committee, and then we can reimburse them based on the expenses that they incurred. Another issue that's going to require further study is going to be to allow local government to use unobligated hospitality and accommodation taxes for other purposes. And this will not be permanent, it will be for fiscal year ending 20 and 21, where they can use unobligated accommodations tax money for other uses. It gives them flexibility with that money. And again, that would be something that would not be permanent. And I think that's all we're recommending at this point as it relates to local government. Going back to the expenses, when I said the expenses are 61.7 million dollars, that's through May. We're going to look at what expenses may occur, and we will make recommendations on that going forward. Any questions? Thank you.
Thank you, Senator Johnson. Senator Alexander.
Thank you, Mr. Chairman. And so this, as I complete our report, I want to thank all the subcommittee members, or all the members of the Reopen South Carolina for being here today and being a part of this, and for the attention of the Finance Committee. I would say, as I complete this report, you know, it's important for us to realize it's kind of out of the ordinary as we do our work, as it became evident to us at Reopen South Carolina. This is about authorization for reimbursement versus what we would normally do as an appropriation bill. This is authorization from that standpoint. Flexibility, I think, is another word that really stuck out with us. We're going to have to be flexible, and as the senator from Clarendon said, as Senator from Beaufort and others have said, also that we're going to have a phase 1 and a phase 2 is all that because there's just too many unknowns out there today for us to be able to address it from that standpoint. Those dates that we were referring to was the latest information we had was May of 18th. I would encourage us to look toward a future date, even for the end of this fiscal year, for authorizations, and then come back when we come back in September. But I do also think this today and what we saw demonstrated how critical it is for us to have the advisors and the auditors that have been provided through and has been procured by the state of South Carolina. Throughout this process, this has made it very evident to me that that was probably some of the best use of the resources that we could have, because they have experience with FEMA and different things from that standpoint. So thank you, Mr. Chairman, and thank you, Mr. President, for the opportunity, your leadership, members of the Finance Committee, for this opportunity for the report from Reopen South Carolina to be before you. This completes our presentation. Thank you.
Thank you so much for your work with your committee, and particularly appointing your subcommittees. And thank you for the presentation to the full committee today. Helps me understand more of what we're looking at. I'm sure it helps the other members of the Finance Committee. And keeping in mind that we come back on the 23rd, 24th, whatever that date is, we'll be on the floor of the Senate, President Peter. And I guess we'll take up a bill, so we need a bill. Based on that, what I did, I was worked with the staff constantly on this, and I heard a comment about should have had it sooner. Well, if y'all try to develop that bill based on where we are today, staff put in a lot of hours, long hours, and I'm proud of our staff. They did a great job working with the staff and working with the working group that I'd appointed, and look at the recommendation of the Select Committee. I developed a bill that's before us today. And Mike, if you'll talk to us about that bill, and let members have questions if they got those.
Thank you, Mr. Chairman. The bill, first of all, behind tab 4 is a one-page summary of the additional federal fund authorization, and behind that is a draft full amendment for your consideration. So, Mr. Chairman, probably some general comments at the beginning to help the members of the committee understand just what you have before you. This is not a general fund appropriation. So many of the normal ways that we think about an appropriation, this is not that animal. This is a federal fund authorization. So the task before the committee today is to establish, for right now, a maximum authorization level for the $1.9 billion of funding provided in the Coronavirus Relief Act. That is a part of the CARES Act that Brian had referred to, that for South Carolina equates to almost $3.6 billion. So think of the Coronavirus Relief Fund as a large part, about 53% of a larger amount of money that comes to the state. Won't take your time to go through the details of this, but in supplementary information behind the tab that Brian had behind tab 1 is a display that looks like this. There are over 50 categories of different flows of funds that are coming from the federal government. All of them, with the exception of one, are as we would think of them throughout state government, because when we write an annual appropriations bill, we authorize the receipt of those federal funds by that agency, and then activities related to that, and they have to follow the federal law. So the Coronavirus Relief Fund is about 53% of that overall amount of money received by South Carolina state government. All funding related to this, per the continuing resolution that was passed a number of weeks ago, is managed by the Executive Budget Office, and that's established in Act 135 of 2020. That's a continuing resolution. The Accelerate South Carolina report and recommendations, and then the Reopen SC Select Committee recommendations were used as a template for the amendment that is before you. However, it is important to remember that the information that has been collected and reviewed, it's estimated. It is simply estimated. It has not been vetted as of yet. So what you see before you in many of the detailed displays that Brian has in his handout are just reports. In all likelihood, whenever these expenditures are submitted for reimbursement, some of them will fall out because they will not qualify. So you are allowing federal authorization to a maximum amount, and then the actual transaction of what may be reimbursed for expenditure, very frankly, could be a lot lower. We don't know the answer to that because the details of these things have to be vetted. As a result of that, and in order to minimize the risk of approving something that may be disallowed by the federal government, our recommendation to the chairman, and included in the chairman's amendment, is contemplating a two-step approach. So today what we have before you is a recommendation to authorize approximately 2/3 of the $1.9 billion in the Coronavirus Relief Act, with the contemplation when we come back in September with the dates that are in the sine die resolution, that then we would write some type of legislation, maybe just a proviso in the appropriations bill, that then addresses the remainder of the authorization that is left. This allows staff the opportunity to know just what has been reimbursed, what's not been reimbursed, what's been allowed, not allowed, and how much pull has been drawn down from these various pots of money. So that's why what we recommended to the chairman is this two-step approach.
Now, let me ask you a question. Help me understand. I'm on under tab 4.
Yes, sir.
The Virus Relief Fund, and looking at line 21, this bill before us recommends a authorization, not an appropriation, but authorization, $1.2 billion, 1.236.
Correct.
Is that correct?
Yes, sir.
Okay. Then the total amount available to South Carolina from the federal government is $1,905,000,000. Is that correct?
Yes, sir.
So when we come back for part two, after submissions are made, determine whether they qualify or not, whether they meet the criteria. And of course, as you said, some of those will drop out. Don't know how many. But based on what we have before us, line 25, when we come back for round two, phase two, the committee will have 668 members, 668 million before us. We can authorize for whatever's needed at that time. Is that correct?
Yes, sir. That is correct.
Okay.
Okay. To access these funds, authorization entities must demonstrate a valid COVID-19 related expenditure. So whenever you look at the language that's in the coronavirus relief section of the CARES Act, it is very clear that it has to be related to COVID. The grants administrator that's been procured by the state is going to evaluate all the requests and determine then if they have a COVID-related activity. And part of that's important because if it is not and the grant is made, the dollars are returned to the state. And if it's particularly at a local level, the monies could be expended, but the state will still be responsible for returning the money back to the federal government at the end of the grant cycle. That is pretty much standard boilerplate language for federal dollars.
Mike, I think I'd like to point out to the committee members, if this committee authorizes money to go to school district, city, town, county, or anywhere, and it's not spent according to criteria set forth by the feds, don't they come back to South Carolina and say, pay us that money back? And we say, well, we went over to school district over yonder. They said, well, why don't you go back and see if you can get it from the school district? You're going to pay us, because if you don't pay us, we're going to withhold funds that we don't normally. Isn't that correct?
Yes, sir.
So it's not that we could go back to the people who misspent the money and say, give it back to us. And say, you go get it, you pay us. We don't care where you get it from. General fund or wherever you want to get it from. So I think that's an important distinction. That was one of the reasons that I was very supportive of bringing on a grants management team, because we have wonderful staff, but our staff is not trained in federal legalese and speak or whatever they call it up there. And I want to make sure we had somebody who dealt with this on a daily basis, that was willing to take some liability if they messed up, that they pay instead of the state of South Carolina paying.
Mr. Chairman, in addition, the funding that is provided is for reimbursements for expenditures that are incurred from March the 1st of this year through December 30th.
Mr. Chairman,
Matthews.
I got one question. When we say the funds are here for reimbursement based on expenditures, my question is, like, hospitals, for example, are funded at different levels, rural hospital versus private hospitals. So you're going to take that in consideration too? So if you just do expensive, rural hospitals probably will get hurt. But rural hospitals, some of them funded at 100%, and some of them funded at 6%, based on whether they are classified as rural or urban. So how it go out in the front end should be taken in consideration, and not just expensive. You follow what I'm saying?
And
Senator Anderson is aware of how we fund rural hospitals.
Right.
And this seemed to be, take that in consideration.
Could Brian help us on that answer?
Yep. Brian, do you have any specific answer you might want to offer?
Matthews, re-ask your question.
Yeah. My question was funding for rural hospital reimbursement. They are currently funded at different levels depending on whether they're classified as a rural hospital or an urban hospital. So when you fund them on the front end, if you just do straight reimbursement, they get hurt. Because currently, if they're classified as a rural hospital with a large poverty patient load, they get a higher reimbursement. So I'm trying to figure that out.
Yes, sir. We've had some initial conversations with the grant administrator on how exactly to handle hospitals. The good thing about the vendor that we have selected, they have pretty expansive experience working with the hospital systems, in particular related to CARES Act. They're currently working with a lot of hospital systems, and I think they can help us design something that will be as equitable as possible. We've also had some initial conversations with staff about how we would handle that, but I think we could work directly with our grant administrator on coming up with the best approach of handling both our rural as well as our urban hospitals.
Mr. Chairman, if I could too, maybe follow up on that then too, the hospitals also have additional pots of money that they would have available to them other than just this CARES Act from that standpoint. And then we'll be just under the confinements of whatever the CARES Act, those criteria from that standpoint as well.
Yes, sir. So there was a separate pot that's included on the larger spreadsheet that I handed out. It's $100 billion that's set aside for hospital and provider reimbursements. And from that pot, approximately $500 million has already flowed to healthcare providers in South Carolina.
Senator Matthews, your mic on.
Rural hospitals are reimbursed based on their classification. And because they got a high percentage of non-reimbursement payment, just that need to be in the formula as
Yes,
we
sir.
talk about spreading the resources.
Yes, sir.
Okay.
Mr. Chairman.
Senator Setzler.
Mike, maybe I misunderstood you to say that this covered expenses through December 30, but under 6A, it really is through June 30th, correct, for those categories?
Correct. Correct. And if you'll allow me to get to that in just a minute.
Okay.
Several additional bits of information to share with the committee. The costs related to the loss of revenue, even if the loss is a result of a health emergency, are not allowable. What they're trying to do is reimburse for actual COVID costs and any costs that's been previously budgeted for the most recently approved budget on or before March 27th. That's not eligible also. Any authorized funding that is unexpended could subsequently be authorized to pay for alternative qualifying expenditures to meet the requirements of the CARES Act. And the Accelerate South Carolina report and the recommendation of Reopen SC Select Committee is for any unexpended funding to be utilized to restore the unemployment trust fund. You heard that policy statement today, and included in the draft is that policy intent. As we get to the very end of the year, near December 30th, the instruction would be given to Brian as to implement anything that has not been claimed as of that time. If there is any additional claim that could be placed in the unemployment trust fund, that would take place so that we fully exhaust this pot of money, the $1.9 billion. Now, Mr. Chairman, if you'll turn to tab 4, the first sheet that I'd like to talk about from an explanatory standpoint is the one that's blue and white that looks like this. And these are the levels of federal authorization that are included in the amendment. You'll see the figures over to the far right column. They will relate to, beginning on page 2 and page 3 of the amendment that is also behind tab 4. If you look at line 4, this is the recommendation inherent in the amendment, a total of $50 million for ORS for broadband mapping and planning, infrastructure, and mobile hotspots. You'll see that that's a combination of lines 1, 2, and 3 above. That's a total of 50. By comparison, as I recollect, did Senator Alexander, Mr. Chairman, Reopen was at a level total, all three of those, of $70 million. The amount that was recommended by Accelerate SC was right at $100 million. So that amount is slightly lower. The recommendation to the committee is the reason why we put 1, 2, and 3 in one larger pot is these, again, are estimates. So we do not know whether or not the state mobile hotspots will cost exactly $20 million, if they could cost $21 million, or it may cost $18 million. So this gives the flexibility to try to accomplish the objective that's set forth in the amendment. So that's the idea behind putting them all on one line and then titling it with all three of those activities that are in there. It just grants more flexibility. The next large number that's included is, if you look on line 7 of the handout.
Question. Yeah. Question.
Jackson, I'm sorry.
Thank you. Mike, would you repeat again so that I can get clear understanding? So the Accelerate South Carolina recommended 100 million?
100 million.
And we're recommending 50 million.
50 on this.
I can speak to that if we could, Mr. Chairman. So it kind of goes back to this being a very flexible type thing as far as, I think the commitment is there. I speak for the members of the Reopen Committee that again, this is the phase 1. So it gives the opportunity to see what can be accomplished on the infrastructure of the broadband aspect, so that when we come back for phase 2, because all of these funds have to be expended by December 30th. So it does include the recommendation that came from Accelerate South Carolina and from the Reopen of the actual mobile hotspots. This is one of those mobile hotspots that would be purchased to go to some of those 100,000 homes or children for their ability to have access to the internet. So so really the component that we don't know is how much can be done with the infrastructure. So that'd give us June and July and August to understand what has been accomplished during that period of time, and if there's additional that can be done to get closer to that $80 million that was committed for broadband infrastructure would help. We still have those funds available from that standpoint.
Mr. Chairman, thank you. It's awkward to sit over there on the side, but just real quickly to address this question, I think it's important for this question and other allocations. The recommendations from both the committees, the Governor's Committee and the President's Committee, were really recommendations for how, by the end of the year, we should expend these funds. What the staff's recommendation is, that I generally support, is that because we don't know exactly how these things are going to get spent, whether it's in broadband or something else, and we don't know what's going to happen between now and September, that we don't allocate all the money today. But I, for one, fully support, if it's needed, from ORS, you haven't got to that yet, but ORS has been tasked with telling us, funding it at 80 million or 70 million or 80 million. We might want to do 80 million when we come back, or 90 million on broadband in September. It's just hard to know right now before we're there how to expend this money. So I think one thing that's helpful for me is thinking about this in a two-step process. We've got a chunk of money. We're going to have to allocate it all. We're probably going to allocate it all out by September. I actually probably would have done less than than this proposal has for overall. I probably would have allocated 50% of all the money. That's just me. But anyway, I think it's important that we think of this as a two-step process. But members, I think it's important that we're committed to each other, that when we come back, we're going to support, generally what the
Senator Heene, I think that last statement by you is what really carries the weight. Everyone I've talked to is committed to putting broadband all over the state.
Mr. President.
No matter when we do it and how we do it. Senator Jackson.
Mr. President, I do understand that statement, but there are going to be a lot of questions to say, if we are totally committed, we are spending $500 million for unemployment insurance, correct? Or are we phasing that in? Or are we putting the $500 million up front? And, the question is, we hear people say again that we're really committed to broadband and we're really going to get it, but you have to trust us, because when we come back, we're going to take care of it if it's necessary. I will argue with you that perhaps there is not a greater issue in our state than the lack of broadband and internet accessibility throughout the state. If you really want to improve the quality of life of And even in some major metropolitan areas, right here in Richland County, 15 miles down the road to the end of the county on the Sumter line, there are students with absolutely no capabilities of doing it. And then you have students 5 miles closer with 13 gadgets in one house on it, and they can do all kind of, you cannot tell me that doesn't give people a decidedly advantage over that. So, I mean, I'm hearing you, and it sounds like what we're saying to the state, again, is trust us.
Let me
we will eventually get to it.
Let me follow up on that, if I may. Right now, and I think I asked Senator Davis this maybe, right now there is no overall plan for broadband that's being developed. I'm not sure they even know how that's going to be developed. There is I won't call it a plan for the workman's comp fund, not workers' comp, the unemployment fund, because that, if I understood, the $500 million we put in there will be spent.
It's already been
And it's not that they got to go out and develop a plan for spending it. I think the difference is we got to have the opportunity to develop the plan for broadband throughout this state before we start dumping all that money in there to make sure it's spent wisely. That would be my response to your thought. I concur. We got to have it. I'm committed to it. But I think we need to spend it wisely. Now, what I've had a concern for, and I've voiced this concern to different people, different entities, I don't want to start duplicating. I heard, well, you got to get the wires on the pole. Well, some people don't sound like they will and let them put them on poles. Is that correct, Senator Alexander?
That has been an issue, yes, sir.
So I think we're in an area that we've never been in before. We got to figure out how we're going to do what really needs to be done. I'm committed. Everyone I listen to, the governor's talked to me. He's committed to it. And I think we just, I don't want to throw money at something not knowing exactly what it's going to do for our people.
Mr. Chairman, I understand that, and I guess I would, I'm trying to see if I could say I support that. I do understand that. But I would tell you this, I don't know if we would ever get a chance again to get this kind of money to really do something that is so monumental and something that is so crucial to the success of South Carolina. And it just, it says to me where our priorities are, we will find a way to make it work. And I just don't want 5 years from now, 3 years from now, when this money is not even available, for there still to be a big section of South Carolina without broadband. And when we try to get it out of the appropriations budget and others, it is not going to be possible.
What we're saying, though, we're talking about two steps here.
Right.
This is the first one. We'll come back. We'll have $668 million. Give us an opportunity to look and see how far along with the plan they are. I can assure you, if I can see that money's going to be spent wisely, I'll be at the forefront of pushing for it when we come back here.
And I guess what I'm saying is that can we, and I know there's no way to put it in here, but can we commit that broadband will be the #1 priority when we come back? That of all the other issues that we may can spend this $668 million, that broadband will get the first look, will get the first bite at the apple.
Under my mind, that would be correct, but I'm not willing to commit. Suppose, listen to me a second. Suppose that the virus, and it looks like I see today's news, yesterday's newspaper, TV, the case numbers are going up, hospitalization is going up. Suppose that our people start dropping like flies. I hope that don't happen. It probably will not, but I think we got to be flexible when we come back here for phase 2.
I understand that, and you know, considering how many of our people don't think wearing masks are important, I guess a
Well-
lot of folk are not so concerned about if they drop like flies or not.
Well, Senator,
Could that-
let me tell you this. For whatever it's worth to you, I am absolutely committed to putting broadband all over the states. I can tell you that.
Just for the record, I would tell you that I'm very concerned about that, and I think it sends the wrong message when we leave here and go to the floor the next week to actually debate that.
I got a senator behind you. Let him. He's been raising his hand. Yes, sir.
Thank you, Mr. Chairman. Can you hear me okay? Thank you, Mr. Chairman. Been sitting for 2 hours. As we say back home, I'm a little stoved up. Maybe I need to get up and walk around. Senator, I just wanted to say that I share your concerns. I'm known as, the senator from Greenville, and when we think about Greenville, we think about 500,000 people there. We think about, everybody's got broadband, everybody's dancing along with the 13 devices, but I represent a very rural area. And this issue is near and dear to my heart, and I anticipate working in lockstep with you because the area that I represent has a lot of donut holes as well. You may have a road going up this way littered with houses, one over here littered with houses. There's broadband on each side. There may be a cut-through street with 6 or 8 houses that has no broadband. Nothing access that way. So, having said that, I reiterate his question. It came to my mind. We're talking about allocating nearly $30 million to broadband now. And from what I'm understanding, there's not even a conceptual plan for this yet, and we got 6 months to have it shovel-ready and in the ground. Is there some piece of the puzzle that's not being shared with us today? I mean, I'm trying to understand because I know how government works, and I know how it works around here. We don't even have a conceptual plan. The committee's not put together yet. And we're allocating $30 million and expecting to have it paid for and with the shovel-ready jobs in 6 months. And Mr. Chairman?
Senator, I guess my response to that would have to be, we're committed to broadband. I want to show good faith that we are committed to broadband. I hear what you're saying, and it's exactly correct. Could we possibly, under any circumstance, spend up to $88 million? I don't know. I'm not sure you can because you got to get it shovel ready, get it put in. That money's not spent by December 30th. We cannot use the money. So,
well, Mr. Chairman,
I hear what you're saying.
Well, thank you, Mr. Chairman. Do we have shovel-ready broadband projects now?
I can't answer that.
Does anyone know?
I can respond to what, Mr. Chairman. Here's what I would tell you. I've been in touch with my county, Richland County, and they said to me that if they had the funding, they can make it accessible to Richland County. I think there are local governments who have done what you said, and they're ready.
Senator,
All they need is the
can
funding.
you share with us how much they could spend by December?
I'm waiting on them to get
Right,
it to
that-
us.
That's my point right there.
Now, let me admit, Richland County is in a different situation than some of the others. But again, there may be, once we put it out to local governments, they may have a plan. They may be working on a plan. The state doesn't have an overall plan, but we haven't consulted, I think, with all of the local governments to see if they have a plan.
And we need to do this at breakneck speed, Senator.
Right.
Thank you, Mr. Chairman. That, unless anybody has any
Since
questions.
Shaheen, you had something.
Well, I was going to have a comment to that question, Senator, try to help you with, those of us who served on this committee had obviously more presented to us. So I'm just going to share a little bit about that. When the governor's task force came and presented, and this is relevant to the senator from Richland's question too, they very candidly said, we have no idea how you're going to spend this money, and we have no idea how much you need. We just allocated this much. Well, for somebody like me who wants to know that money's well spent, that really doesn't cut it. I'm not blaming them; they were doing this quickly, but that's not a good way to allocate money. When ORS came and testified in front of us, they had some very thoughtful recommendations, suggestions, and it really focused around how the state as a whole could gather data, create a plan, and understand how we can implement broadband across the state. And that costs money. Like to gather the data costs money, to figure out where these holes are in Greenville and Chesterfield.
I would think, Senator, that the providers could tell you that.
Well,
quickly.
They can't. Yeah,
can't?
They cannot. And the state doesn't control that data. Senator from Beaufort heard this testimony as well. And part of what we have to do is capture that data from providers, from studies that we have to do ourselves because the providers can't tell you that data completely. And so in this, Mr. Chairman, in this proposal, which I don't think staff has briefed us on yet, one of the charges is for ORS to put together a plan. Otherwise, this is not going to work because we'll have no plan, and a committee's not going to come up with a plan.
How quickly is this plan supposed to be put together, Senator?
We'll have to look it has to be very quick. Yeah. Otherwise, it won't be expended. But we can't just go spend this money willy-nilly without thought.
No, and I'm so far
Yeah.
to the right, I'm almost left. So I'm with you on being
Yeah.
fiscally
And then they have to
conservative.
report the plan back to us, and otherwise we're just throwing money down the drain.
Okay, so will they issue a report that will get?
I believe that language is in the proposal,
okay.
but I'm sure we'll get to that language.
Let me go back to Senator Scott. He's waiting patiently, Senator Scott.
Thank you, Senator.
Mr. Chairman, there are a number of companies and organizations who are doing broadband, even as large a company as AT&T, who's involved in broadband, and it may be more of an urbanite development, and some of this fund can go to expand what they actually need so they can expand some of the loopholes that's out there. But I think the biggest concern is being able to provide broadband in rural communities that don't have accessibility. And that's where this past session, last year, and the little part we had this year was spent sitting down at the table with co-ops and those who represent rural telecommunication. They've been working really hard trying to come up with a solution to how those rural companies can get involved, working together to expand broadband. And I think that's where the real interest is, where this money is going to be spent. But I would say to you that some of that money that's here, some of the companies that are involved who have been drawing down federal money as well for expansion, as well as to continue to improve, they can use some of that money. Because if you're in close proximity, of course, you're going to be able to get some of those internet accessibility.
And I agree with you, but my question goes back to what I asked Senator Jackson.
Well,
how much money can they spend between now and December 30th?
Well, that's going to depend upon, I think, an earlier comment you made, depending upon what this General Assembly actually does.
Right.
If we move to put in place the group and create the structure, then we'll actually know. That does not mean that it will, in fact, take care of beginning to put cable in the ground or running lines on top. But at least we begin to promulgate some regulations and know who's going to manage this process, because I think that's where the problems are. You've got so many, even rural counties are trying to do, you got so many different hands in the pot because we've not developed a structure to do it. Then I think you can come back maybe 2 or 3 months from now and then begin to look at what you can be in the contract.
That's what I'm saying. Yeah. This is phase one.
Right.
We'll come back for phase two.
Well, I'm not in disagreement with you on it.
Yeah. Senator Alexander, didn't I hear that this money cannot be used for the main highway infrastructure type thing?
It can be used for what they would call dark fiber, for that infrastructure from that standpoint. But again, you've got to have it in place and done by December 30th. I think there's two things, and I think everybody's in agreement with broadband. We understand the importance of that, fully committed to it. It was in one of those conversations with either Congressman Clyburn or his office that a statement resonated with me. This is a down payment on what we need to do with broadband. There's other, as Senator Malloy mentioned, Senator from Hartsville, we're anticipating some $300 to $350 million to be coming to South Carolina either shortly or down the road dedicated to broadband as well. So we need to do, to the senator from Richland's point, the best we can with this money. We just simply, as we heard the report, as a senator from Kershaw mentioned from Accelerate South Carolina and others, that they heard across the board, as we did, from all of those subcommittees, broadband's a big deal. They didn't know what could be done with how much money, but they felt like they wanted to show their commitment so they put in that amount of $80 million. We're saying, let's get started, let's see where we are, what can be done, and then if
come back here in September and evaluate, look at it
and
again.
by then, hopefully we'll be well on our way with our plan and all the other things, but certainly committed to address, and there's a lot of different issues, just like there's been resignated here where you've got some that's got it, some don't. So there's a lot of work to be done, and I look forward to getting moving with it.
Mr. Chairman,
That's a-
of course, broadband, in my opinion, is one of the things, if not the most important thing right now we need to do in South Carolina for our people. And Lou Kennedy, who is a resident of Lexington County and the president of Nephron, I think is undertaking this as a project that she's going to spearhead and be moving forward. I've got a specific question on the broadband infrastructure, the 29.7. Is that going to be money that people apply for to be able to do infrastructure to provide broadband? Is that what that is? And let me tell you the reason I'm asking, and those of you who were on the Reopen Committee have more knowledge than we do. I've got two co-ops. One's already doing broadband, another one's in the process of trying, but it costs money. Is this money that a co-op can access, or what? Explain to us exactly what that pot of money is.
Mr. Chairman, that would be any provider that would include the broadband, the co-ops. It would include any entity that's in the broadband business.
So that money, they can go, if they get it, they can go to work.
That's right. It'll be a competitive process going to that, and they'll be evaluating. And certainly, we want to make a commitment back to making sure that we've got rural areas that don't have any broadband at all. But yes, sir, they would certainly have access to doing that. Absolutely.
So and we're going to get asked this question, somebody's going to ask this question, then who's going to make the determination of that 29.7, whether vendor A gets it all, or if 5 vendors apply, that it's pro rata?
I think that's going to be directed through under the phase 2, and then certainly in conjunction with the Office of Regulatory Staff would be involved with that aspect of it from that.
Wait a minute now, you just confused me because I understood you to say.
Well, the 2.97 would be available now.
That's my point. So you got 29 round numbers available now, and we pass this, and you got 5 vendors who apply for part of the 29.7. One of them may want all of it. Who makes that determination?
I think that would have to come with the criteria in a RFP put out for that, or what they would call a reverse auction from that standpoint of the number of
the executive budget office.
Them in consultation with the Department of Administration and the different folks like that, because they'd have certain criteria, like how many houses, how many folks are going to be able to get internet from that standpoint. So you want it to go as far as you can from that standpoint.
Okay.
Well, Mr. Chairman, sometimes you just have to look in the language. So if you turn to page 6 of the amendment, Senator from Lexington, it details out the requirements of the Office of Regulatory Staff to develop a secure vendor through a contract, like you would do, to determine what needs there are in the state for broadband infrastructure. It to the points of the senator from both the senators from Richland, it says in B2 that you should, as you reimburse providers, there should be an emphasis on rural communities with high prevalence. Remember, all this has to be COVID related, or else you can't spend it. I mean, we can't just pretend like we're going to put broadband all around the state. That's not what this money is for. It's for COVID related expenses. If you look in B1, it talks about the hotspots. Senator from Oconee has talked about. That'll happen immediately. These school districts that need them can go ahead and get them and then apply for this money. There might be some tweaking that's needed for this language. If so, I think we should give that tweaking to the staff as we move forward. Remember, all this stuff has basically been drafted in 7 days.
Right. And Mr. Chairman, for the edification of the committee, there are 3 general criteria for which reimbursements will be made. It's telecommuting, telehealth, and then remote learning. So there's a much more narrow focus on what would be reimbursed. Federal, those are the federal requirements. So while an additional benefit to the state may be that there is more broadband capacity that goes to certain areas, for the reimbursement to take place, it has to be in those three general areas. It has to be focused on that.
Mr. Chairman?
That's a
Senator from Kershaw, as I read 10A, it says they will have a vendor for mapping. I don't know that when it speaks to infrastructure that it says a vendor, and frankly, I hope it wouldn't be necessarily one vendor. It might be multiple vendors.
Right, it's in 10B2 is where it talks about actually the things that where it would actually be expended. And that is reimbursable expenditures for infrastructure expansion must be necessary, and it ties back into the things. And that could, in my mind, reading that could be anybody from the Richland 1
Correct.
school district to whatever, and that's contained in that paragraph there.
Right, and I
And
agree.
again, if you need to fine tune this language, I think anybody should suggest to staff changes that they think need to be made to perfect it.
Mr. Chairman,
Jackson.
to Mike's point, which is a good point, but you can, in essence, say that in areas where they can't get virtual learning because there is no broadband, funds can be spent in that. So, hypothetical, a county like Richland County, there are pockets or donut holes, as the senator from Greenville says, where there's no broadband. That is a direct impact to the ability to have virtual learning, correct?
Correct.
So you can spend it. Basically, any county municipality that seeks the money, it can easily justify how this will provide that virtual learning.
Anyone else?
Mr. Chairman,
Yes, sir. Senator Peeler.
could I ask Mike, could you point out any glaring difference between the reopen select committee's report and recommendation and the amendment? That would help me and maybe save some time too. If there's any glaring differences, and if so, where are they?
The primary differences are in the broadband, that's line 4.
Okay, we've talked about that.
Talked about that. The hospital line, that's public and private hospital line, 13, the recommendation
Okay,
before
let's
you.
stop now. I know the senator from Lexington has had questions about that. Are you satisfied with that funding, senator from Lexington?
I've raised the question several times about Greenville County and whether they gave that money to a hospital, and I was provided information late yesterday afternoon. That was not the case, and it detailed what Greenville County had spent that money for, or where they had allocated, and that was the question that I had.
Any other?
I don't recollect what the recommendation from Reopen was on line 20, the state and local government expenditures. Do you remember?
It might have been a little bit less than this, but I think we're taking in consideration to June 30th. It's consistent with our recommendation with the information we had from May 18th. This is just extending it to give them through June 30th. So I would say that is consistent. That's not different from that standpoint.
Mr. President, Mr. Chairman.
Senator Jackson.
Okay, again, let me, on what the senator from Lexington said, look, and no disrespect or no offense to the people from Greenville, but I don't see why we need to do anything for Greenville County when they got $91 million up front. If they chose not to give it to their hospitals, that's their business. They take it up with the local Greenville folk. But for the rest of the 45 counties who did not get anything.
Senator, let me ask you, is there something in here directly given to Greenville?
No, I just want to say that as we look at hospitals,
okay.
as we look at hospital systems, because we can give to a hospital system, i.e. Prisma, who's based in Greenville, maybe we ought to be very specific, that none of those funds ought to be used for anything that is Greenville related. Let it go to Sumter, let it go to Prisma in Richland County and some of the others. Because I don't feel like we should do much to help Greenville other than they got the $91 million. That's right. Sounds like equity to me.
Anyone else have questions?
Mr. Chairman, there was one other recommendation that's in
Hey,
here.
Mike, I'm
Was
sorry.
$10 million for the consultant. That's different from reopen. That's the other difference.
Talk to me about that difference. What about?
Right, that, I don't think reopen recommended the $10 million. for the consultant.
Mr. Chairman, we didn't have that information to include in our report for the procurement of the consultant. So certainly we would have embraced that had that been the case.
That pretty much covers it.
Anyone else? Further questions? If not, I'm gonna give us a vote.
Mr. Chairman,
Sorry.
real quickly, just kind of with the fine tuning on the you heard my presentation, our presentation on the education portion. With the summer catch-up camps, I was approached and asked, right now that language, the way it's written, it's really unclear as to whether it just applies to kids who were previously in the school. And the question was, if you have a kid living in that district, whether they were in that school or not, maybe they were, moved there, maybe they were at a private school, could we allow them to go to the summer camp if they meet those criteria? To me, that makes a lot of sense. The goal here is to get these kids face to face. And I just wanted to, if there's no objection, I would suggest to the staff that
If
maybe we
anybody
keep that
can
language.
answer that for the Senator.
Mr. Chairman, I would just ask that I would second his to include the language that would allow if a child's moved into the district, that they would be eligible for those reading.
So we'd
math and reading.
instruct staff to amend it.
Yes, sir, yes, sir.
Anyone else?
Yeah, one question, one clarity.
Senator Scott?
Yeah, some of the, this is Director Senator Sheen, some of the larger school districts, like District 2, I got calls on them saying that they did not have that problem that basically what you were talking about related to trying to find the rural students and using DSS for the purpose of. Their system was doing quite fast because they had the broadband, they had the teachers, there's a greater income level of individuals, so they thought they should have been excluded from the face-to-face as required, because you looked at the whole, all the students overall. They had some real concerns about some of the districts, those larger districts who in fact.
Senator
were doing
Sheen, would
quite
you
well
want
with it.
to think about amending what you just amended
Well,
and say if they choose to?
Well, it already, so they only, let me answer the question, they only have to offer these summer camps if they choose to. They do not
but-
have to.
But then they lose the funding
Well, they only
funded too.
get the funding if they want to have the summer camps.
and the direct face-to-face.
Yes, but they can still do, if they want to do virtual ones, they can, but this money, the goal of this money was to get those kids in the classroom with the teachers, because we know that even when they can do the virtual, for the vast majority of kids,
And that's the argument they
it does
made.
not help them
That's
to
the
the level
argument
they
made,
need.
that, because of their system.
They're wrong if they're saying,
understand that, but-
if they're saying their virtual schooling to the vast majority of kids is
So-
good
But
in
I think,
person, they're
I
wrong.
think the example that you used, and I go back to your example with
Senator
DSS.
Scott, if, what I'm hearing, if it's optional with them, does that?
Well, the optional
No,
part, the money doesn't follow with the optional part. They can do it anyway without, but they weren't, based upon the language we have, they excluded from being able to get the funding if they did virtual. And some of the large urban schools don't have the problems that the rural school districts have, because they've got broadband.
Well-
They've got the teachers, they've got the locations to do it, and they're the ones who are doing much better in terms of education in the rural school.
There, I guess, Senator Scott, the committee, all I can give you is what the committee's feeling was. The committee's feeling was, based on the testimony, that even when they can capture these kids virtually, our kids are suffering because they're not in the classroom.
Well,
And
that's
so
why-
the goal of this money was to get the kids in the classroom. That's the best way I can say it.
Okay, anyone else? If not, we're going to take a vote. Thank you, sir. Got a motion and a second to adopt the amendment. Reported out favorable. Mike, you want to call the roll?
Yes, sir. Chairman Leatherman.
Aye.
Aye. President Peeler. Aye. Senator Setzler.
Aye.
Aye. Senator Matthews. Senator Matthews not voting. Senator Reese. Aye. Senator Alexander. Aye. Senator Grooms. Aye. Senator Verdon. Aye. Senator Cromer. Yes.
It's proxy, and he's a vote.
Proxy.
Aye. Votes aye.
Senator Jackson? Aye. Senator Williams? Aye. Senator Campbell? Aye. Senator Davis? Aye. Senator Nicholson? Aye. Senator Shaheen? Aye. Senator Martin? Senator Martin not voting. Senator Scott? Aye. Senator Allen? Aye. Senator Gregory? Senator Gregory not voting. Senator Bennett? Aye. Senator Corbin? Aye. Senator Hembry? Aye. Senator Johnson? Aye. (20-0).
24 of 24
20-0.
voting, right?
We had several that didn't vote.
No, I'm saying 24 of 24 voting, right?
It's a total of 20 who voted. 20-0.
20 to 0.
Mr. Chairman?
Yes, sir.
Now that you finished the vote, I would ask or either move, whichever one you would prefer me to do, that the the President of the Senate has already emailed the Reopen South Carolina report to every member of the Senate, I believe. I would ask that what's behind tab 1 and tab 4 be sent to the entire Senate as soon as possible so that they have that. I have members who are asking, of our caucus, for example, that are asking, and the sooner we can get that information to them, the better, in form of a motion, Mr. Chairman.
Go out today. So.
Okay, thank you.
Anything else to come before the committee?
Chairman, I'm proud of the Senate, proud of this committee, proud of the Restart Committee. This is the way government's supposed to work.
Absolutely, sir.
Thank you, Mr. Chairman.
Yes, sir. All right, well, thank everyone for coming, and we will stand adjourned until next time, whatever the next time means.